Today, we're going to dive into a real-life medical detective story. It's about a patient whose body was sending out some serious distress signals that all the usual treatments just couldn't seem to touch. So here's the puzzle. A man's blood pressure is just through the roof, and it's causing damage all over his body. But the real reason why, the true culprit, was something that was hiding just beneath the surface. All right, let's get into it. Part 1, a dangerous medical puzzle. This is where we meet our patient and really start to understand the massive challenge his doctors were up against. So our patient is a 38-year-old man, and right off the bat, he's considered very high risk. I mean, he's been dealing with high blood pressure for a decade. Plus, he has diabetes, obesity, and his kidneys are already showing signs of disease. And here's a really key detail. He has a tough time taking his medications consistently. This whole background just makes the severe new symptoms he's about to have even more terrifying. Okay, so let's move into part 2, following the clues. Just like any good detective story, the investigation kicks off by gathering all the evidence you can find, starting with what the patient himself is going through. These aren't just little complaints. These are alarm bells going off all over his body. The killer headache and blurred vision, that suggests the pressure in his brain and eyes is dangerously high. The chest tightness, that points to his heart just straining under this incredible load. And the swelling and shortness of breath, classic signs of fluid overload, which could mean heart failure. Every single one of these is a critical clue. And when you look at his history, wow, the plot really thickens. He was diagnosed with high blood pressure at just 23 years old. And he's got this long history of it being out of control, his kidneys getting worse, and he's even had a hypertensive emergency before. This whole pattern is just screaming at the doctors, this isn't your garden variety high blood pressure. There's got to be something else causing it. And then they find it. The pivotal moment in the physical exam. The doctor puts a stethoscope on the patient's abdomen and hears something called a bruit. It's this distinct whooshing sound, a sound that absolutely should not be there. This is it. This is the golden clue, and it points directly to a major problem with the blood supply going to his kidneys. So, with that huge clue in hand, we head into part 3, the lab's revelations. This is where we get the hard data, the cold, hard evidence that is about to crack this case wide open. First up, his creatinine level, a really key marker for kidney health, is way too high. This tells us his kidney function has just taken a sharp nosedive. Another measure, called eGFR, which is kind of like a report card for his kidneys, has dropped like a rock. He's not just dealing with his chronic kidney problems anymore, he's having an acute kidney injury right now. The situation is getting worse, and it's getting worse fast. And that's not all. Next, his potassium is dangerously high. This is called hyperkalemia, and it's another absolutely crucial piece of this puzzle. It's tied directly to his failing kidneys and, as we're about to find out, even to one of the medications he was on. And here it is, the smoking gun. A special ultrasound, a renal Doppler, confirms exactly what the doctors were suspecting. The artery that feeds blood to his right kidney is 60 to 70% narrowed. It's a massive blockage. This is the physical problem that little whooshing sound was hinting at all along. The mystery? It's solved. So now, in part 4, we can put all the clues together and finally name our culprit. The diagnosis is for a hidden cause, renovascular hypertension. So, what on earth is renovascular hypertension? Well, it sounds complicated, but it's actually pretty simple when you break it down. Reno just means kidney, and vascular means blood vessels. So it's high blood pressure caused specifically by the narrowing, the stenosis, of the arteries that feed the kidneys. We finally found the root of the entire problem. What happens here is just this dangerous chain reaction. Because that artery is so narrow, the kidney isn't getting enough blood, so it panics. It thinks the entire body's blood pressure must be dangerously low. It's like it hits a giant panic button, activating this powerful hormone system that floods the body with chemicals. These chemicals squeeze blood vessels tight all over the body and force the body to hang on to salt and water. And the result? A vicious, relentless cycle of sky-high blood pressure. All right, now for the solution. Part 5, a new plan of attack. See, now that they know the true cause, the medical team can finally stop chasing symptoms and come up with a targeted plan to fix the actual problem. So the first move is a little weird. It seems counterintuitive. They actually stop one of his main blood pressure medicines. Now, why on earth would they do that?
Well, it turns out that for this specific problem, a narrowed renal artery, that particular drug was actually making things worse. It was hurting the blood flow inside the kidney even more and was a big reason his potassium was so dangerously high.
The full plan from here is a full-on assault. First, they have to get that pressure down safely, right now, using IV meds. Second, get rid of all that excess fluid with diuretics. Third, switch him over to a much smarter, safer combo of drugs for his specific condition. Fourth, and this is the big one, make a plan to go in there and physically fix that narrowed artery, probably by putting in a stent. And finally, of course, you have to address the crucial lifestyle stuff, like his diet and quitting smoking.
Okay, let's zoom out for a second and look at the final lesson here. What can this one person's incredible story really teach all of us?
The single most important thing to take away from this is simple. Not all high blood pressure is created equal. Yeah, most cases are what doctors call essential hypertension, where there's no single clear cause. But sometimes, like in this case, there is a very specific and very treatable secondary cause.
This case really gives us a powerful checklist of red flags. You should always be thinking about a hidden cause when blood pressure just won't come down with multiple medications, or when someone has these recurring blood pressure crises, or when their kidney disease just gets worse and no one knows why. And of course, if a doctor hears that telltale whooshing sound in the abdomen, this whole story is just a powerful reminder that in medicine, looking beyond the obvious diagnosis can literally save a life. It really forces us to ask a much bigger question. What other common conditions, the ones we think we understand completely, might also have a hidden treatable cause just waiting for us to find it? That's a question that drives medicine forward every single day.